you have a clinic, and you have your doctors, and you have, some number of health coaches with each. So there is there is a cost that's sort of building there. How, have you looked at what are the numbers like in terms of outcomes for your patients, in terms of savings for these self-insured companies?
Yeah, so a really important point is our goal is not to save healthcare costs, right? If anyone tells you, I'm going to save you healthcare costs, I would be careful, because it's actually really easy to save healthcare costs in the short run. Just don't do things for people, right? And then bad things happen downstream. We've seen that script before, right? Back in the 80s in managed care. We don't want to do that. So I think everyone in our practice think our job is to actually improve people's health. And if we improve their health, that will save money, because there's so much waste in the system. So, and actually our job isn't even to improve their health. Our job is to improve their life.
Right.
If we can improve their life, that improves their health, that saves money. Now, do we save money, right? This is not a charity. And it does. So we had a practice in Atlantic City which started in 2007. We had a gentleman, Arnie Milstein, who was a healthcare consultant, commissioned a study, a case control study. Take the people in the practice, match them to a control group, people who look like them but didn't go to the practice, and follow their trend lines across, right, with an independent academic from Harvard. And what he saw is that the primary care costs were double, which is the model. Drug costs actually went up a bit because people actually take their medications. Our fill rate at the pharmacy was 98.8%. I mean, most doctors don't have the foggiest idea what their fill rate is, but it's a lot less than 98.8%. Usually it's in the 70 to 80% range when people look. Emergency room visits dropped by 48%. So half. There's a question, what percentage of people don't need to be here? About half. Hospitalizations dropped by 41%, and total spend dropped by 12.5%. So this is better care, cheaper. And then the outcomes. So, I told you the hypertension stats. So when people come into one of our practices, only about half, 55%, are under control with hypertension. We get that number up to 90%, and similar numbers with diabetes.